Methods of oxygen administration. It can be done by two methods, low flow delivery devices and high flow delivery devices. In low flow delivery devices, the first thing is nasal cannula. You can see in this picture, it is commonly used device and it is safe and simple and it is acceptable and comfortable by the patient. And this nasal cannula, it is useful for patient requiring low O2 concentration. It allows the patient to move about in bed. Especially the patient can eat, talk or cough while wearing this device. That is the main peculiarity of this nasal cannula, and it is low flow concentration and it is most commonly used. Next one, simple face mask. Simple face mask, the O2 can be given quickly for short period and it is useful for transporting patient. O2 concentration here is 30 to 50% and the flow rate will be 60 to 12 liter per minute. And mask needs adequate humidification. And simple face mask, here it is given for short period and it is helpful for transportation of patient, and the flow rate O2 flow rate is 6 to 12 liter per minute, concentration is 30 to 50%. Next one, partial rebreather mask and non-rebreather mask. And when you are observing this mask, it is similar always, but only one difference is non-rebreather mask has valve. In partial rebreather mask, this is lightweight and it is easy to wear, and reservoir bag conserve oxygen here. So that is helpful for high flow oxygen therapy for the patient. And this device, it is not used for COPD patient, and this device not used along with nebulizer. And high humidification also not needed in partial rebreathing mask. In case of non-rebreathing mask, higher O2 concentration can delivered accurately. O2 flows into the bag and mask during inhalation, and this valve prevents expired air from flowing back into the bag, and it is good for patient needed for higher O2 concentration. And this bag should not be allowed to deflate during inspiration. Make sure this valve are open during expiration and closed during inhalation to prevent drastic decrease of FiO2. So here the non-rebreather mask, here we have to remember regarding the valve and make sure this valve are open during expiration and closed during inhalation, and it is useful for high O2 concentration. Next one, oxygen conserving cannula. Oxygen conserving cannula, you can see that a reservoir bag is connected along with the O2 cannula, right? So this cannula built a reservoir that increase O2 concentration delivered and allows the patient to use lower flow. That is, here 30 to 50% of O2 concentration is used, but it is in a low flow rate, in a low flow manner, and it can deliver up to 8 liter per minute. In oxygen conserving cannula, there will be a reservoir and here the O2 can be collected. That is, here the O2 concentration will be 30 to 50% and it can deliver the O2 with a flow rate of 8 liter per minute. Next one, transtracheal catheter. This catheter is less visible and flow requirement may be reduced approximately 50 to 70%. And it can be increase the flow rate gradually. The O2 concentration also can increase gradually here. And here there is no nasal irritation because it is given by transtracheal route. So the irritations will be less here, and we can give a low flow rate, low O2 concentration around 50 to 70, and if needed we can increase the O2 concentration also. Next one, phase tent. Phase tent is ideal for providing moderate high density aerosol. So this phase tent we are using for a high density aerosol, and O2 concentration administered varies through flow rate. Next one, tracheostomy collar. So here the collar can deliver high O2, high humidity and O2 via tracheostomy. So in tracheostomy collar means already via tracheostomy we are giving O2 concentration. Okay. Next one, tracheostomy T-bar. So in tracheostomy T-bar, there will be a T-piece will be connected to the tracheostomy, and through this we are giving O2. This tight fit allows better O2 and humidity delivery than tracheostomy collar. So that is the merits of tracheostomy T-bar. Till now we have discussed low flow delivery devices, that is nasal cannula, simple face mask, partial rebreathing mask, non-rebreathing mask, oxygen conserving cannula, transtracheal catheter, phase tent, tracheostomy collar, tracheostomy T-bar. Now we are dealing with high flow delivery devices. In high flow delivery devices, only one important thing, that is Venturi mask. And this mask can deliver precise high flow rates of oxygen. And here there is, you can see in this picture, there is lightweight cone shaped devices, and it can be fitted to the mask, and we can deliver variety rate. Okay, different rate of O2 concentration. For example, we can give delivery of O2 concentration 24%, 28%, 31%, 35%, 40%, 50%, etc. Okay, so the oxygen delivery can be varied along with these conical shaped devices, and here we can give high flow and precise O2 concentration to the patient, and we can manage the flow rate along with these conical shaped devices, and it is very useful for the patient. Okay, so these all are the methods of oxygen administration in that low flow delivery devices and high flow delivery devices. Low flow delivery devices, it is nasal cannula, simple face mask, partial rebreather mask, non-rebreather mask, oxygen conserving cannula, transtracheal catheter, phase tent, tracheostomy collar, tracheostomy T-bar. But in high flow delivery devices, only one thing, that is Venturi mask, and it has cone shaped devices that helps to deliver O2 concentration accurately and precisely in different way. Thank you.